pericardium is everything that you're going to see around the heart itself. So if he tags what layer is surrounding the heart, he's asking for the pericardium. There are two layers, the visceral pericardium and the parietal pericardium. You don't need to distinguish the two layers, so you don't need to worry about that. However, what he will do is he's going to lift this up and he's going to point to the muscle layer of the heart that I'm touching right here. This is the myocardium right here. Anything in the middle is the myocardium. And if he talks about the lining of the ventricles or the atria, he is looking for the endocardium for that. Wait, Karen? What's that? Anything that, if he's asking for the layer that lines the wall, the inner walls of the heart, that is your endocardium. The apex of the heart is going to be the point of it right there. That's the apex of the heart. The base of the heart, I never heard that. Just really quick, is the base the top? Never heard that. Yep. Okay, so the apex is here, and the base of the heart is kind of the top part of the heart, where all these vessels are. This is the base of the heart. So the base is actually on top. Apex on the bottom. The base is where all these vessels are on the top here. All right, let's talk about the major vessels that enter the heart. I started on the list here saying there are three major ways that blood goes into the heart. We have a superior vena cava, an inferior vena cava, and a coronary sinus. So on this particular model, this part right here, or if I tag right here, this is the superior vena cava going in. Down here is the inferior vena cava going in. And if you see this big purple thing right here, that's the coronary sinus. That's where all the blood that's feeding the heart, all of that eventually, all the oxygen that feeds the heart dumps back into this thing, which is the coronary sinus right back here. These three major vessels enter the heart and enter into this chamber of the heart here, which is the right. This actual chamber is called the right atrium. This little flappy thing looks like a little ear. This stuff right here, that is called the right auricle right here. Lift it up, the hole is called the right, or this chamber is called the right atrium. And after that, I say that the word pectinate muscles are the muscles that line the atria of the heart. You can see that this muscle right here, underneath this flap, those are called your pectinate muscles. Let's get the big heart now. In this big heart model, what vessel is this that's entering the top of the heart? This would be the what? Superior vena cava. This would be the inferior vena cava. What's this little flap thing called on top of the atria? This is called the right auricle. Lift this thing up. This chamber of the heart is called the what? The right atrium. The muscles lining the atrium of the heart, this is what kind of muscle? Pectinate muscle. Good. There's a few features of the atrium that we need to know. It's called the fossa ovalis. Okay, so if we look inside the heart, I'll go over that. Y'all see this indentation right there? That's the fossa ovalis, which used to be a hole when you were a baby. We'll learn more about that later. That hole is the opening for the coronary sinus. Between the two atria. Now, let's go on down. This chamber pumps down, and it's going to go through this valve right here. Y'all see that? This is my tricuspid valve. That's the one on the right side of the heart. You see these little stringy things right here? The heart strings? Those strings are your chordae tendineae. Go on to this part of the heart. I should have it as well. A lot bigger here. You can see here's the tricuspid valve, and the little heart strings are the chordae tendineae. In the ventricle, the muscles look a little bit different. As you can see here, here's a wall of the ventricle. The muscles don't look as nice as the pectinate muscles. They kind of look beefy, like ground beef, and that's what the word trabeculae carne means. Carne means beefy. So, and trabeculae means worm-like. So it looks like a bunch of worms, and it's lining the walls of your ventricle. So if they ask you the kind of muscles that line the walls of the ventricle, that is going to be your trabeculae carne. Another type of muscle that you're going to find is, you're going to find papillary muscles. And if you look right here on the heart, you see these bulbous muscles. They're usually attached to the chordae tendineae or to the valve. This little bulbous muscle is called a papillary muscle. So that's the third type of muscle that you need to know about. Pectinate muscle, trabeculae carne, and then this little long muscle right here, which is a papillary muscle. If I asked you what chamber of the heart are we in here, put a piece of tape, what chamber are we in now? This is the what ventricle? This is the right ventricle. Good. The right ventricle is going to contract, and it's going to go through this valve right here underneath the heart, which is called the pulmonary semilunar valve. That's going to lead up to the lungs. As it goes through the pulmonary semilunar valve, it's going to go into this structure, which is called the pulmonary trunk. The pulmonary trunk divides into a right and left pulmonary artery, and then these things become pulmonary arterioles, and they enter into the lungs. They become capillaries, oxygen is exchanged, they become venules, and then they turn into 4 pulmonary veins. So moving on from that, I'm going to take this off. I'll review this later. So, here are 4 pulmonary veins. Please remember, everyone gets confused. Arteries are usually always carrying oxygen, as you know. However, in the heart, they do not carry oxygen. Arteries are always leaving the heart, right? And normally, they carry oxygen. But here in the heart, the pulmonary arteries do not have any oxygen because they haven't gotten any oxygen to them. Veins usually do not have oxygen because they're going back towards the heart. And here in the pulmonary veins here, that's why we call them pulmonary, they've gotten to the lungs. So these are the actual, one of the few cases in your body where your veins have oxygen in them. So please always remember that. Pulmonary artery and pulmonary veins are different colors in the heart. The pulmonary veins enter what chamber of the heart next? They're going to go into this chamber, which would be the what ventricle, what atrium. This is the what? This is the left atrium. What is this little flap over the left atrium called? The left, just like the right side. So here's your right auricle, here's your left auricle. This chamber of the heart is called the left atrium. That's going to contract, and it's going to enter through this valve right here. What valve is separating the left and right, the left atrium and ventricle? This is called the bicuspid valve. What are these stringy things called on the valve? Those are your chordae, what? Chordae tendineae. Good. What kind of muscles line the ventricle of the heart? We talked about that earlier. That's called the trabeculae carne. What is this big fat bulbous muscle called? That's a papillary muscle. Again, I can tag that. See that big bulbous muscle? That is a papillary muscle. The left ventricle contracts, and it's going to go through another valve. That's going to be this valve way up in here. That's the aortic semilunar valve. Once it goes through there, it's going to go through the ascending aorta, the arch of the aorta, the descending aorta, and it's going out to the rest of the body. That's all the basic anatomy of the heart. Any questions on that? Let's go ahead and review it one more time, and we'll do it on the smaller model of the heart.